Acne is the most common skin disorder in the U.S. affecting, get this, 60 million people. Now, 85% of Americans will have acne at some point in their lives. We usually think of acne affecting teenagers, but many, especially women, struggle with acne well into their 30s, 40s, and beyond. If left untreated, 1/3 of those affecting have scarring. But there are plenty of things that you can do. Acne expert Dr. Germain of Germain Dermatology has more on this. Good morning, and I tell you what, it affects so many Americans and adults, and I know some of my children, and even I still have acne sometimes, and I just turned 60.
Yeah, absolutely, Tom. It's a huge issue for my patients. In fact, it affects women and men of all ages and races. And a lot of times people say just leave it alone because it's just acne, it'll go away. But it can have a big effect on self-esteem. It can lead to scarring.
Really?
Yeah.
Yeah.
And
And
that's
the self-esteem, especially
Yes.
in teenagers, while going to school, and they've got that, they really want to take care of it because it can be severe. It can be just a little bit of acne, or it can be really severe.
Yes, it can. And you know, it's most devastating to adult females with acne because in the United States, 1 in 4 American women over the age of 25 have adult female acne. 25% of them never even had acne as teenagers. And 75% of women in the United States who have acne say that it's either the same or worse than it was when they were a teenager. And that really has a big effect on them.
Why would a lady especially have acne in her 20s and never had it as a teenager? Is it because the body is changing at certain times? Or?
Right. The body changes, it's genetics, it's hormones. I mean, men get acne too, but it doesn't bother them as much when they're an adult. They can get very severe acne, of course, when they're teenagers.
When you talk about severe acne, there are different levels of acne.
Yes.
Tell us about that.
Yeah, so there's mild, moderate, and severe acne. You can see on the picture here that mild acne is kind of the blackheads and whiteheads. Moderate, you add in those red bumps, and then severe acne, you add in the cysts and the nodules. The misconception is that only the cysts and the nodules lead to scarring, but all types of acne can lead to scarring.
The types of acne that you're talking about, I mean, we've got teenagers that are doing it, people in the middle age, people in the older age as well, and the different areas, not just on the face, but it can affect so many areas of the body.
It does. It can affect the face, of course, the neck, the chest, the back, the back of the arms, and the butt. We call it butt knee.
Why does acne develop, just say, on the back? Because most people would think acne is on the forehead, the cheeks, around in this area, but not too much on the neck and not too much on the back. But it does develop on the back.
Absolutely, because there's sebaceous glands on the back. Anywhere there's sebaceous glands and hormonal intervention, you can get acne.
Sebaceous glands, that's what's
oil glands.
Oh, the oil glands. We all have oil glands, but some we have more oil than others.
Exactly.
So tell us about the treatment. How can we work on that?
So the treatment for acne, you always want to combine different treatments and make it very unique for everybody's acne, because some people respond differently. And in my office, what I like to do is we have lasers that we use, we have peels, we do microdermabrasion, we do something called photodynamic therapy, but I always like to start with topicals first and then add in other things. And in my office, we have Germain RX products, we have washes that we have different levels. So problem skin 1, 2, and 3. We have toners and pads that we use that can be used after exercising because skin is very sensitive to sweat. There's topical preparations for clearing blemishes, or you can use it all over. There's scrubs and polishes. There's sprays, so you can spray those hard-to-reach areas on your back. Now, the most important thing to use is retinol, because retinol turns the skin over so the acne papules don't form. It's very important, especially for adult women, because it's anti-aging. But a lot of times, insurance companies don't cover medications for acne, especially when you're adults. So these are a fraction of the price of prescription medications.
So that is not a prescription medication?
It's not a prescription, but in my opinion, it acts just as well or better than prescription. So it's not something that you have to worry about if your insurance company doesn't cover those things.
And one of the things, you have some unbelievably great products that are right here with cleansing and so forth. But one of the things that an individual can do to help prevent or spread is to not be touching their face. Keep the hair off the forehead.
That's so huge.
The oily hair and everything, it just continues to make the acne even worse a lot of times.
Well, the reason why people pick is they want these acne things to go away, right?
If they pick it, it's going to go away.
Yes, exactly. And especially women, when they get those deep-seated acne along their chin, their jawline, their neck, those are very scarring, so you have to be extremely careful. But there are some things things you can do at home too to help with acne. You can drink more water, get enough sleep, decrease stress. Sometimes it's easier said than done, right? Avoid white flour and white sugar and artificial sugars because that causes inflammation. And acne is an inflammatory process, so you want to avoid inflammatory things. Try to avoid dairy. So if you want to drink milk, drink almond or rice milk, and take omega-3 fatty acids and vitamin D. Keep your body healthy, and then your skin will be healthier.
Great information. Keeping your body healthy, mind healthy, body healthy, your skin is healthy. How can folks get a hold of you?
Yeah, so you know, if people do have problems with acne, they can come and see us. We customize programs and regimens for them. We love our acne patients. We're very passionate. We like to help people because this does have a big effect on self-esteem. It affects the way people interact with others. It affects decisions that they make. So they can reach us at Germain Dermatology. It's located off of Long Point Road. Very easy to find. 612 Seacoast Parkway in Mount Pleasant.
Always a pleasure.
Yeah,
thank you so
you.
much. More coming up after the break. Please stay with us.